Thank you for the invitation to talk, and I appreciate this venue. All right, I'm ready. Could you start at the beginning, please, for me? Thank you. I'm going to talk about anti-harassment and bystander communication training. I have no disclosures. I think we all know that in the workplace there is a power differential between our learners, our staff, our faculty, our leaders, and this can lead to a mismatch in relationships in terms of microaggressions, bullying, and workplace harassment. And I think we all know that it's very difficult to stand up against harassment and bullying. And what I'm going to provide you is some tools on how we can go from a bystander to an upstander. So what are the risks and attitudes and behaviors that we are addressing? So microaggressions were first described in the 1970s by a psychologist who noticed that microaggressions are used commonly to keep a group of individuals down, and they still persist. So there are three forms of microaggressions. First, microassaults differ from micro-insults and micro-validations, but each subgroup entails a form of general disrespect, devaluation, and prejudice, and exclusion of recipients. So micro-assaults are different to the others in that they are conscious biases or discriminatory verbal abuse or behaviors, whereas micro-insults are unconscious messages that are insensitive and disparaging to a person's gender, racial identity, or background. And micro-invalidations are behaviors and statements that are meant to exclude or negate and dismiss one's personal feelings and thoughts or experiences. Each subgroup entails a form of general disrespect and devaluation and prejudice. So what are the effects of microaggressions on healthcare and our patients? We know that microaggressions, biases, prejudice, and stereotyping can increase healthcare disparities, particularly for those in lower socioeconomic groups and racial minorities. They can result in hypertension, cardiovascular diseases, diabetes, and respiratory conditions. There are multiple papers on this, and this is just an exemplar of minority women who are less likely to use, i.e. be offered, spinal anesthesia for childhood delivery, and that African American women have the highest odds of undergoing general anesthesia for C-sections compared to white women. So what are the effects of microaggressions on healthcare providers? We know that workplace mistreatment can result in depression, lower quality of life, job dissatisfaction, and burnout, as well as suicide ideation. This results in suboptimal care practices and medication and medical errors, as well as decreased patient satisfaction. This is an exemplar of the prevalence of microaggressions and mistreatment in our surgical residencies. 1/3 of general surgical residents report discrimination based on gender, with almost 20% reporting it based on racial discrimination. And who are the perpetrators of these microaggressions? We think it's generally our faculty, but it's not. It's actually patients, both for racial discrimination and gender discrimination. And 1/3 of our residents experience emotional exhaustion weekly, 1/4 depersonalization, with the prevalence of burnout higher amongst surgical residents. So it is important that we stand up to microaggressions, not only for ourselves, but when we witness it amongst our peers and our colleagues. So obviously the rationale is to engage our institutions into furthering equity, to create accountability for the perpetrators of microaggressions, to raise the awareness that it occurs and the effect of microaggressions on the daily experiences of workers, as well as to encourage action to disrupt the power hierarchy, provide an opportunity to plant seed, and importantly to empower change to occur. So there are multiple ways at an institutional level that we can address microaggressions and discrimination, but essentially it's committing to diversity, equity, inclusion, and justice, both in terms of providing roles and departments, diversity-themed programming, inclusive comments, and communications and marketing, as well as establishing codes of conduct. It's establishing a culture of openness and respect, as well as inclusion and accountability, and what I'm going to focus on is these skills-based strategies that you can employ every day. So how do you go from a bystander to an upstander? Well, I'm going to talk about the active bystander training. So the aim of the training is just to develop some tools, have the tools and language to respond and to affect change within your institution. So there are indirect and direct strategies. The indirect strategies redirect the focus of the attention of the perpetrator to the victim. They uplift the target who's encountering the microaggressions, and they use affirming counter-narratives to oppose microaggressions. Direct strategies are actually to take direct action, to reflect back on what's been heard, to communicate the impact, and to raise awareness. And of course, direct strategies also include checking on the person who's been a victim of microaggressions and discrimination, and to reaffirm boundaries. So we have all heard of the 5 Ds or 4 Ds of active bystander training, but I'd add that the 5th is documentation. So there's a direct action, there's a distraction, there's delegation, and the delay and documentation. So direct action is when you confront the situation openly. Obviously, this is not something that you want to do if you feel like you're in a unsafe environment, particularly if someone's intoxicated or under the influence of drugs. But it's giving verbal or nonverbal cues to the person perpetrating the microaggressions. It's a head shake or it's a call out of the behavior. Is this appropriate right now? Or I know you're joking, but it's making me a little uncomfortable. It's making us all uncomfortable. Or to use questions instead of statements. What makes you say this? I'm surprised to hear that you're saying this in this room at this time. So it's really taking direct action. If that's not working for you or you feel it's unsafe, then it's creating a distraction. This is a temporary action to immediately de-escalate the situation. So you enter the space between the aggressor and the victim, and you ask unrelated questions, or you might divert or distract attention away and say, hey, I need your help with this patient, or what are you doing this weekend, or hey, do you want to go get a cup of coffee? So it's actually entering the space and distracting the person who's perpetuating the microaggressions. Then delegating. If you feel like you can't step in yourself because of the power differential, it's asking a colleague to stand in. And this is very important as leaders in our community. If you witness this, take action. Don't just walk away or act like it hasn't happened. I'm sure we've all been victim to microaggressions and discrimination in our institutions. Or talk to your supervisor or program director, and if this isn't working, then talk to HR. And finally, one of the actions is delay. This is where you provide emotional support for the person who's been a victim of discrimination or microaggression. It's check in to see how they're doing, acknowledge that the events occurred, and support them and ask them how you can personally support them and what you can do at the institutional level to help them. And it's also to provide resources. But be sure that your activities align with your institution's policies. A great exemplar is what happened at a program that we're all well aware of, where there's overt discrimination and no one talked about it, and they just supported the discriminator instead of the victims. And that's clearly not according to the ACGM guidelines when you're in a training program. And finally, document. Always document. If this means emailing the program director or the chairman or HR, you need to communicate this, or writing down your own notes with a date, because you may be asked at a later date to act as a witness or to act, to indeed support the person who's been a victim of this, that these actions were indeed occurring and inappropriate. And not only that, but it's important that you conduct yourself according to your institutional policies. So just to summarize the ways that you can go from a bystander to an upstander, it's direct action. So directly say something to the perpetrator. Distract them if you don't feel safe with that measure. Delegate, get some support. Delay, i.e. support the person who's felt the discrimination and harassment, and document. And I'm happy to answer any questions at a later time. Just know that it is your place to speak up. We all have fears of speaking up. We don't want to be considered troublemakers or harming our relationships or ruining our reputations, or importantly, feel the fear of retaliation. I think if everyone in this room empowers yourself to speak up, we can single-handedly change the culture of our institutions. And I'll end on this thought.